Human rights are inherent to all human beings. It doesn't matter if you're black or white, gay or straight, young or old, or any other status. We are all equally entitled to these human rights. And these human rights are interrelated, indivisible, and interdependent. People having the right to live is inevitable. It is stated in our Article 2 of our human rights, saying that nobody can try to end your life. However, having the right to die is a bit questionable. The right to die is a concept based on how others believe a person is allowed to end his or her life by undergoing voluntary euthanasia. My stand on this argument is that people have the right to life, at the same time, the right to die.
Well, Kramer, having just seen the movie The Other Side of Darkness, and not wanting to be in a coma like that lady in the movie, hereby want Jerry Seinfeld to remove my life support, feeding machine, lung blower, etc., etc., etc.
My first argument will be about the Hippocratic Oath. The Hippocratic Oath was a belief accepted by physicians that is dated back to the time of Hippocrates. It is said that the phrase primum non nocere, or first do no harm, summarizes this kind of oath. When a person asks for assisted suicide due to intense pain and suffering, society thinks that this is wrong and try to keep them alive, but what they do not know is that they are actually hurting the person more than necessary. It is argued that if a physician refuses voluntary euthanasia, he or she is violating the Hippocratic Oath stating that you must do no harm. My next argument will discuss about the general misconceptions of voluntary euthanasia. The most general misconception is that society generally sees euthanasia as a term for murder, killing, or even death. But I can tell you, in 1938, the Euthanasia Society says that it is most likely preferred as merciful release. Proponents of euthanasia says that it is most likely for the terminally ill. As Dr. Foster Kennedy said, euthanasia was born for the defectives, who are doomed defectives. It is an act of mercy to release the suffering of the terminally ill who has been struggling with his or her illness. Of course, it will be on their terms, of course.
Just seen the movie The Other Side of Darkness, and not wanting to be in a coma like that lady in the movie, hereby want Jerry Seinfeld to remove my life support, feeding machine, lung blower, etc., etc., etc.
The first victories came in the form of advance care directives, or living wills, and the court decisions were loaded with the language of autonomy and dignity to justify pulling the plug in the case of brain death. And then when the first physician-assisted death laws were passed, dignity was front and center again. Indeed, such laws are often called death with dignity laws. Today, 5 states effectively allow physician-assisted death, and in each, the medication can only be prescribed when certain requirements are met. In Oregon, for example, you have to, among other things, be terminally ill with a fatal diagnosis of less than 6 months.
The day that I learned that I was terminally ill, that there was nothing that medicine could do to ameliorate even my symptoms, I decided that I wanted to live as long as I could, as best I was able, and I wanted to die with the dignity with which I had lived.
My last and final argument will be about compassion. Before we decide, it all comes down to this certain question. Should we or should we not allow the patient to undergo euthanasia due to his or her illness or symptoms? According to palliative care, it is a no, since it is a system that gives pain reduction and prescriptions to patients' symptoms of illness. But if you think it this way, palliative care is only used for those treated illnesses. What about the harder symptoms like cancer, or AIDS. These are illnesses that are uncurable and gives a slowly and painful suffering towards the patient. And having uncurable illnesses like these rather, could lead to a slow and painful death to the patient and refusing the right to end his or her life or giving them at least an option for them to choose. We are increasing the pain and indignity suffered by this person. In summary, people have the right to die on their terms. Voluntary euthanasia should be implemented in order to give an option to those who are terminally ill and those who are suffering due to their condition. I would like to end my speech with the words from Anthony Kennedy, Supreme Court Justice, stating, and I quote, "At the heart of liberty is the right to define one's own existence of meaning, of the universe, and of the mystery of human life and death."